Hello, everyone. I'm excited to be here, and I'm so excited for everybody else that is joining us here on this webinar. This is a very important topic, something really close to me. And I'm really excited about the fact that so many of you from the community will be learning about how cancer drug therapies can be associated with your heart health. So type in any questions you have in the chat, which will be addressed towards the end of my presentation. So today we're going to be talking a little bit about how cancer and cardiac diseases are related. We'll talk about who is a cardio-oncologist and what's going to be their role in treatment of your heart diseases while you're going through cancer diagnosis and getting managed for it. We'll talk more about the kind of heart diseases that can be associated with cancer, different kind of cancer treatments, including the ones which are most commonly treated for, like breast cancer, lung cancer, prostate cancer, blood cancer. We'll talk about how each one of these medications and treatment options being used can have some sort of effect on your heart and what should you be looking out for if you're a survivor specifically, or even when you're going through the treatment. And I have a few case-based scenarios which we'll be discussing more about. If you were a patient presenting with a certain symptom, what are the kind of testing we do? What are the complications you should be aware about? So who really is a cardiologist? So cardiologists like me we are a part of medicine that have extensively studied more about heart diseases and heart health. We help in diagnosis of heart issues like, say, coronary artery disease or heart failure or cardiomyopathies, and we'll go over the details of what kind of heart diseases are expected in cancer diseases specifically. But we help with diagnosis of these diseases and management in their future. Who is an oncologist? So, cancer is an abnormal situation in your body where the normal cells from a particular organ will just start having its own brain and start dividing just continuously into an abnormal pathology and start destroying that particular organ. So, oncologists are the specialists in medicine that take care of cancer. They diagnose you with cancer and they give you different kind of treatment options for the management and try to put you in remission. So, cancer treatments, there are a variety of cancers. There could be different type of cancer associated with even a single organ. For example, there's breast cancer, but there are subdivisions even within the kind of breast cancer that you might have had. Lung cancer, there are a variety of lung cancers such as squamous cell carcinoma or small cell carcinoma, etc., adenocarcinoma, etc. So each one of these subtypes of cancer has a different treatment option. So in the market, when you Google, say, what are the cancer options available for me for treatment, you'll have tons of options that come up. Each one of these treatments has its own downsides and positive parts. These treatment options were created so that the cancer is treated and you go into remission. But what's not understood enough is about what kind of other side effects they have, particularly on the heart, which is only something which we're learning as treatments are advancing. There's a lot of medications, a lot of these newer medications tend to have lesser side effect on the heart than what it was like a decade or two back. But there still are heart diseases that tend to roll over as you continue your survival journey in remission. With all the advances in cancer therapies, cancer survival has significantly improved. But these patients, because of the fact that they are old and they are surviving, they do have cancer risk factors or diseases that are going on within them. Cardiovascular disease is a leading cause of non-cancer death in cancer patients. A lot of these risk factors of cardiovascular diseases are also overlapping with your cancer risk factors per se. So cardiovascular risk factors tend to get worse or progress during your cancer therapy. And the oncologist can also pick a certain other kind of treatment, an alternative to a particular treatment of your cancer if you have cardiovascular diseases per se. So the outcome of your cancer will differ based on what your heart health looks like as well. In the US, currently there are 18 million cancer survivors, and it's only expected to be increasing. So it's expected to increase up to 22 million by year 2030. A lot of these patients would be older than probably 65 years or say 70 years, which forms the bulk of our survivors at this point of time. Even in a normal population, cardiovascular diseases is quite prevalent. But in patients that have survived cancer, it's a lot more. It's about 2 to 6 folds higher risk of having cardiovascular diseases and death from it in patients that have survived from cancer. The highest risk of having cardiovascular diseases and bad outcomes coming from it is during the first year of your cancer diagnosis, predominantly because you might have had all these risk factors which were never looked at, and you're also, plus on top of all of these things, getting treatments, which only makes your cardiovascular diseases worse. So, what are these overlapping risk factors between cancer and cardiovascular diseases? So, it's all of these metabolic problems that you could have, like high blood pressure, diabetes, being more obese, being sedentary, not working out much, high cholesterol levels, high blood pressure, etc. And what does cardio-oncology really do in this situation? So cardio-oncologists are specialists predominantly who are heart specialists, but they have done a lot of research and a lot of reading and expertise about cancer patients since the diagnosis of cancer until they go into remission and they're being followed up by oncology. So at every step of your cancer diagnosis and management, your cardio-oncologist is going to be working very closely with you and your oncologist in order to modify your risk factors. Like I was mentioning, the hypertension or high cholesterol levels or diabetes and obesity, and making sure it doesn't progress to something more severe, like say a heart failure or heart muscle weakness or heart attacks, etc. So it's really important to recognize the fact that these risk factors are modifiable when caught early on. So early diagnosis is the key to making sure you don't have bad outcomes from heart diseases when you're still fighting and surviving cancer. So there are a variety of cancer treatments available to our patients. Like I was mentioning, every single cancer type has its own set of treatment options available. Most of the time, if a cancer is resectable, your oncologist will offer surgical management of those masses. If they need more treatment options, say they need drugs in order to kill the cancer cells on top of the surgical debulking, they offer drugs such as chemotherapy. So chemotherapy is predominantly chemical drugs which act not just against your cancer cells, but also on your normal cells, which includes your heart muscles, and that's how they cause heart diseases in patients. Radiation therapy for a particular organ that is affected tends to involve heart when it's close by. For example, if you have breast cancer on the left side or you have lung cancer on the left side, your heart comes in the way of radiation penetrating through your breast or your lung cells, and that's how your heart gets affected by radiation therapy as well. Immunotherapy. So these are medications, these are drugs which have been modified in order to activate your own immune system against your body cells. So it acts against the cancer cell, but at the same time, they do have predilection for certain other kind of organs as well and cells as well, including your heart. Targeted therapies are again medications which have been modified in order to go attach to a certain protein or receptor on your cancer cell to kill them. But sometimes they go and start targeting other body cells as well, including your heart muscles and heart cells. So that's how they tend to cause heart issues in you. A lot of the cancer and cancer treatments tend to have a variable amount of symptoms. So patients usually have weakness, fatigue, they don't feel like themselves. But on top of that, the cancer treatments can also cause inflammation and irritation in a lot of your body parts, including brain, including your heart, sometimes your lungs, liver, your gut sometimes, your skin and muscles can be affected as well. So you can have a variety of symptoms from overlapping side effects of cancer and their treatment options. But at the same time, even heart issues can have certain other presentation symptoms like, say, chest pain, shortness of breath. If you're feeling palpitations, feeling like your heart races fast all the time, or if you're dizzy, lightheaded, These are some of the red flag signs which we look for in patients that probably have something cardiovascular going on top of their cancer diagnosis as well as the treatment. So what does a normal heart look like really? So here on the left side is just a picture of how your normal heart looks like. So there's top chambers of the heart called as right and left atria, which receives blood from different parts of your body. And there's bottom chambers of the heart called as left ventricle and right ventricle. The right ventricle connects to the lungs, so it supplies blood to the lungs through this purple colored vessel over here, which is called as the pulmonary artery. And the left ventricle pumps blood to the rest of your body. So it goes through aorta, which is this major blood vessel, which you see in the red here, a huge pipe which supplies blood supply to the rest of your body. And here on the left side is some echocardiographic pictures. Echocardiogram is a test that's very commonly done in cardiology. If you say you have a specific symptom during your cancer treatment, most likely your cardiologist or your cardio-oncologist will prescribe you this sort of test. So it's an ultrasound of the heart where the heart actually looks upside down. So what you see here at the top is actually the bottom chambers of the heart, which is the left and right ventricle. And what you see here at the bottom is the top chambers of the heart called the atria, right and left atria. We visualize heart in different views in order to make sure we're not missing anything. We see all the chambers of the heart, all the valves, which basically are like doors between the two chambers of the heart. So the right atria and the right ventricle, have something called as a tricuspid valve, which are these structures which are opening in order for the blood to flow from the top chambers to the bottom chambers. And same way, there's a mitral valve which separates the left atrium from the left ventricle. So these valves can also be affected by cancer therapies. And we'll talk more about which kind of treatment is going to cause what kind of diseases predominantly and things like that. So what are the different kind of heart diseases per se? So there are some heart diseases which are intrinsically present in you just because you have heart diseases already existing at the time of your cancer diagnosis, and because you're old and you have other risk factors, probably like high blood pressure, high cholesterol, diabetes, obesity, all the things that we spoke about previously. But there are certain other heart diseases which could be caused by the kind of drugs or radiation treatments that you're getting specifically for your cancer. So atherosclerosis, which is basically coronary artery disease. This is one of the more common kinds of disease that's present in the general population and also predominantly present in a lot of our cancer survivors. So there's blood supply to the heart from the outside, which basically is this red little wire-like thing that you can see on the heart in the center here. This is the blood supply of the heart. So it's like a tube, basically. And there could be deposition of calcium and cholesterol as you start aging. And that could be just because of your lifestyle and all the risk factors that you have. But it can get to a point where your pipes are clogged. There's not enough space for the blood to flow across the pipes. And that's why your heart is not getting enough blood flow, which leads to some of the symptoms like chest pain, trouble breathing, exercise tolerance has gone down, and things like that. So that's called as coronary artery disease. The more severe form of coronary artery disease is when you have a heart attack, which basically means that the arteries are completely clogged. There's not enough blood flowing across the pipes at all to reach your heart muscles. So your heart muscles basically are feeling extremely weak and they're not getting enough blood. And that's an emergency. If you have a situation where you have a lot of chest pain that just started maybe a few hours to a few days before, trouble breathing, you're feeling lightheaded, dizzy, you are not feeling like yourself, sweaty, extremely cold and clammy, time to go to the emergency department so that they can check you out about what's going on with you. Some of these issues, like I mentioned, the coronary artery disease and heart attacks can be inherently present in you just because of the risk factors. But sometimes while you're going through treatment for your cancer, some of the drugs can induce these issues to you too. So be cautious about that. Pericardial disease here at the bottom, which basically means that the sac that surrounds your heart, which is like a shock absorbent really, is inflamed and irritated because of some sort of procedure that you might have gotten or some sort of drug that you're getting as a part of your treatment. So the inflammation of the pericardium basically would present similarly with chest pain and trouble breathing, feeling like you may not be able to breathe well if you're laying flat and things like that. So keep an eye out for those new symptoms as well. Myocarditis, that is inflammation of the muscles of your heart. So the muscles are basically these reddish things which basically contract well in order to push out blood to different parts of your body. But if there is inflammation because of some sort of medication you're getting, you can present with similar heart pain symptoms and trouble breathing, etc. Cardiomyopathies are caused by radiation and certain drugs that are, used in treatment of variety of cancers, which basically causes weakening in the muscles of the heart. So the heart is not able to pump out blood as it should be. So there's weakness, which eventually leads to what's called as heart failure. Conduction system can also be affected by certain drugs. As you age, unfortunately, just like how calcium starts depositing in the blood vessels of your heart, there could be calcium deposits at the valve as well as your electrical system of the heart. And that leads to electrical abnormalities. Top chambers of the heart can have abnormal rhythms like atrial fibrillation or atrial flutter, if any one of you has heard about it. Bottom chambers of the heart tend to have more serious and destructive kind of not destructive but dangerous rhythms, like atrial fibrillation or ventricular fibrillation or ventricular tachycardia, which is basically caused from scars from repeated damage by anything, say of infiltration or any kind of procedure that you might have gotten through, or just scarring as a part of your aging. Valve diseases, like I mentioned, are the doors between different chambers of the heart. There are certain drugs which over a period of time tends to cause more calcium deposits in them or fibrosis on them, which leads to narrowing in these doors or making them too leaky. They become too big or too narrow, which causes a set of their own symptoms. So these are the most common kind of heart diseases people tend to, experience when they're going through cancer treatment or as they're aging. So what is really the goal of cardio-oncology with all of these things? So prevention is the key to go to prevent anything from developing, really cardiovascular diseases from developing while you're diagnosed with cancer or going through treatment or in remission. If you do have a cardiovascular disease or risk factors, then we try to diagnose you early on and try to monitor you and manage you accordingly, depending on what your risk factors are. How do we do that? The diagnosis really is based on clinic visits. So you see your cardiologist, you see your cardio-oncologist in the clinic. We talk to you extensively about what's your lifestyle looking like, what are your symptoms, what kind of cancer diagnosis do you have, what kind of risk factors do you have with cancer, which could have led to the progression of cancer, what kind of treatment options are being discussed for you. We coordinate very closely with your oncologist about any symptoms that you have, any testing you need, anything that might delay the treatment of your cancer because of your heart diseases. And sometimes that happens. We do an extensive physical examination. We listen to you. We listen to your heart, your lungs. We check your veins, etc. And then depending on what your symptoms are and what your risk factors are, we do blood testing. We send out blood testing for any kind of enzymes that basically could indicate that your heart is under stress, which are troponins and NT-proBNP and things like that. We might request for an EKG, which is the electrical rhythm of your heart is checked while you're in the clinic. We might request for an ultrasound of your heart, the pictures of which I showed in a couple of slides before. Depending on what your risk factors are, if I'm considering you to have coronary artery disease or a more severe kind of complication from coronary artery disease called as heart attack, I might refer you for a stress test or cardiac catheterization, respectively. So really, depending on what your risk factors are, we try to triage what needs to be done for you specifically and expedite the workup. So how do you really try to prevent from cardiovascular diseases developing or even progressing with all the other things that you have going on in your life. The most important thing is your diet. Try to have the healthiest diet as possible. Mediterranean diet, which is predominantly grilled or baked food, lots of salads, lots of veggies, lots of fruits, fresh fruits and vegetables are going to be the key to go. If you're somebody that eats a lot of red meat, I would recommend that you cut down on that. Cheat days are okay, but don't make that your routine. And try to avoid processed food as much as possible because food processing modifies the molecular aspect of your food, and nobody knows in long term how it's affecting on your heart or your health in general. Be active. I recommend exercising for at least 30 to 45 minutes a day for 3 to 4 times a week, every single week if possible, which is going to help you regulate your weight as well, which prevents you from developing obesity, which again is a risk factor for worsening cardiovascular diseases as well as outcomes of your cancer. If you are a smoker, I would highly recommend you to quit it. Even a single cigarette has been shown to worsen your cardiovascular health. Half a cigarette, single cigarette, none of it is going to work really. So quit it as much as possible. Vaping is an option only for transition, but if you are vaping nicotine, it's still bad for your health, for your heart health. If you're a smoker, if you're a alcoholic, anything more than 2 drinks per day for men is on the higher end, and anything more than 1 drink per day for women is higher on the higher end. If you say I don't drink the whole week, but on the weekend I try to drink say maybe 2 or 3 drinks, that's still on the higher end for you. That's still called binge drinking. So anything more than 1 per day is on the higher end for women, and anything more than 2 per day for men is on the higher limit. So control that. How do we tend to manage you and monitor you? We follow up with you very closely in the cardio-oncology clinic, depending on, again, what your symptoms are and how you are doing in your life, symptoms-wise. We might ask for more EKG testing, the electrical rhythm of your heart, blood test, ultrasound of your heart, or more testing, more additional advanced testing, like say cardiac MRI or CAT scans or catheterization, really, depending on, again, what your symptoms are. And how do we manage? So there's a variety of managing techniques, and everything, again, is tapered down to what your needs are. If you have heart muscle problems, the muscles of your heart are weak, could be from anything, could be from insufficient blood flow to your heart, or could be from the kind of drugs that you got for your cancer therapy, or in general, your heart muscles are weak because of infiltrative cardiomyopathy or fibrosis is what we say. We start you on good medications and try to help you make those lifestyle modifications I was talking to you about in the previous slide. If you have coronary artery disease, which we'd be concerned that is severe enough to not supply blood to your heart, we refer you over to cardiac catheterization, where they might put a stent. So a picture here which says percutaneous coronary intervention is basically a stent, which goes into your blood vessel, which is marked in red here. And what's blue and fenestrated is the stent. So they pass the stent, they blow open the stent, and the stent sits there, and you're asked to take an aspirin and a super aspirin for about 6 to 12 months later, and make lifestyle modifications on top of all this. Because even if you put a stent, it's more like a band-aid to your problem, but your real problem is your lifestyle issues in these cases. So we still want you to modify and work on your lifestyle while we're still treating you for all these active issues that you have. If you have an electrical rhythm issue of your heart, then we refer you over for something called as a pacemaker or a defibrillator, which is here. So this is basically a device which is sitting at the top of your chest, right underneath your skin, which is a generator, and it's got wires which go all the way to your heart and attaches to your heart. It senses how your heart is functioning, if it's electrically working fine or not. And if it's not working fine, then it paces it. It paces with electrical beats, which is coming through the generator here at the top. If you have valve disease, say you have something called as aortic stenosis or mitral stenosis, we offer to crack open those valves and put a new valve in that place, which is basically the picture here depicting what an aortic stenosis would look like, which is basically heavy calcium deposition on your valves to an extent that it's so narrow that the blood is not able to pass through the two chambers of your heart. So we basically blow it up with the help of balloon, and then we put a new valve in that position of your old valve, which essentially opens up the door again for the blood to flow across different chambers of your heart. And say you're really sick, you're in the hospital, you're almost on your deathbed, but we still think that there are ways to go. We can manage you with what's called as mechanical circulatory device. These are treatment options that are available to pump in place of your heart if your heart function is really weak and you're in something called as cardiogenic shock, where basically your heart is just not able to pump blood and all your organs are going down just because there's not enough circulation in your body. So if you are an appropriate candidate for mechanical circulatory support, we tend to advocate for you and get you those kind of treatments while you still try to recover your body. Your body tries to recover from everything going on. Say you are a young patient that got chemo early on in your life, say when you were 20s or 30s, and unfortunately have heart muscle weakness as a complication of those drug therapies, we can talk about potentially a cardiac transplantation if you qualify for it. But there are steps for it. You really have to be very sick in order to get those heart transplants done. And you need to have that amount of severe damage to your heart as well. So those are all the kind of treatment options that we give our patients for those who have heart issues. So now we'll talk about different types of cancers and real life scenarios, which I've really seen in my clinical practice, and go about how we'd manage those patients and talk a little bit about specific treatment options and associated cardiac issues with those treatment options for that particular cancer type. So talking about breast cancer now, say we have a 55-year-old female who's undergoing active breast cancer treatment. She's had shortness of breath ongoing for a couple of months, and she already has risk factors of high blood pressure, diabetes, and cholesterol. We already know this patient is at risk of having cardiac issues while they are going through treatment and during their remission as well. So we ordered an EKG, the electrical strip looked fine. We ordered a bunch of labs. Everything looked fine except this particular enzyme called as NT-proBNP, which basically tells me that your heart is under stress. Maybe it's going into heart failure. It's not able to pump well. So we offered an echocardiogram, and I don't know if you can recognize, but the heart function is weak. The heart should be vigorously, pushing out blood, but this heart is a little weak. It's on the lower side. I would say about 20-25% of the heart function is present. So for a normal heart, for a really normal heart, it's not 100% of the time that it contracts. It's about 55 and above is considered a normal range for a normal heart. In this patient, I would say it's about 20-25% heart contractility. So we diagnosed her with heart failure. That means there's weakness in the muscles of the heart. We offered her additional testing to see why exactly the heart is weak. Is it because of the drug therapy that she's going through during cancer, or is it because she's 55 years old and she's had a poor lifestyle all this while? She's got risk factors and maybe has some coronary artery disease, not enough blood supply to the muscles of her heart, which is causing the weakness. We started her on good medications, and we followed up very closely with her oncologist about what the future plan should be regarding her treatment. So that's what we do for our patients that are coming up with symptoms and have heart failure. So in terms of breast cancer treatment, your oncologist will offer you some of these therapies, really depending on whether you have hormonal positive cancers or whether the HER2 is positive, which are basically molecules in your cancer which will react well to certain specific medications. Anthracyclines here in the middle are one of the more commonly used medications for breast cancer, at least used to be, but they're trying to switch that over to different other kind of medications which have lesser cardiac side effects per se in the current era, in the contemporary world. But anthracyclines have been associated with making your heart muscles weak and giving you more abnormal rhythms of the heart, which again needs to be diagnosed by a cardiologist, followed up with cardiology or cardio-oncology. Trastuzumab is another kind of medication which tends to weaken the muscles of your heart. Immune checkpoint inhibitors rile up your own immune system to act against your own body, including cancer cells, but that's how they tend to have their side effect. So when your own body T cells, which is basically the immunity cells, are going against your cancer cell and your heart muscles, you can have irritation and inflammation in your heart and in different organs. It can cause irritation and inflammation in any kind of organ that you have in your body. But with heart particularly, it tends to cause inflammation around the sac of the heart or in the muscles of the heart, which can give you specific symptoms associated with each one of these diseases. And again, what we do as cancer doctors, cardiologists, cardio-oncologists, is that we assess what your symptoms are. We prescribe blood tests and certain other tests, really depending on what your symptoms are, and go from there. Coming to scenario 2. So this is about lung cancer. Say you're a 65-year-old male who is getting active treatment for lung cancer, and now you have chest pain ongoing for 2 days. Don't ignore that. Go to an emergency department. When we tested blood, your troponin and NT-proBNP was abnormal, which basically means your heart is under stress. It's not getting enough blood flow, which probably is making your heart muscles go weaker and cause heart failure. So this person was diagnosed with coronary artery disease. And here is the ultrasound of the heart in different views. Heart muscle is weak. Again, I would say about 20-25% is the ejection fraction, the contractility of the heart. And this is the cardiac catheterization. So this is a specific test which is given to patients that have high chances of having a heart attack. Or if we are concerned that there's not enough blood supply going to your heart, we do this test where we pass catheters through your wrist or through your groin all the way to your heart, and we push some contrast into the blood supply of your heart and see if they're open or blocked and what's the severity of your blockage. So here on the right side here is the right-sided blood supply of your heart, which basically looks like a little C. It's got some disease, but it's not clogged per se. It's not completely clogged. It's working. But here on the left side, there should have been two different vessels, one at the top here, which supplies the front of the heart, and one over here, which you can still see, if you can see my pointer here, which is the left circumflex artery, which supplies the sides of your heart. The one that supplies the front of the heart is blocked. And that's why you're not even able to see it. So the patient basically got a stent to the front, the blood supply of the front of the heart, and did okay thereafter. But he had to be, again, he got the stent, he had to be started on medications to improve the strength of his heart, which needs to be continued for at least a few years and until we make sure that the heart function has come back to normal. He follows up closely with the cardio-oncology group as well as their oncologists, and we coordinate very closely with his oncologist about the treatment options, which is going to be safe from the heart perspective, per se. So lung cancer treatment, again, depends on whether it's resectable or not. If it's a localized tumor, the surgeons might be able to resect it. You tend to get radiation therapy. Again, if it's coming closer to your heart, if the lung mass is coming closer to your heart is at risk of having exposure to radiation, which can have a set of its own problems. Immunotherapy, where your body acts against its own cells and the cancer cells. Targeted therapy, where there are medications which are targeting against certain proteins present on the cancer cells and try to kill them. And there are chemotherapy options as well, which are basically chemical drugs against cancer cells specifically. Scenario 3 is that of a male, 60-year-old male that has prostate cancer and is undergoing prostate cancer treatment with medications and has been diagnosed to have new high blood pressure. Again, we send out certain blood tests. We see that his Diabetes numbers are controlled. His other tests are fine as well, but his cholesterol level is really high. So he's got new high blood pressure and he has abnormal lipid panel, which is abnormal cholesterol levels, again, which increases his risk of having cardiovascular diseases in future. It's important to understand the fact that when you have prostate cancer or breast cancer or ovarian cancer, there are medications given to autoregulate your hormones. So in prostate cancer, there are medications given to reduce your testosterone, which again tends to cause a set of metabolic problems in your body, including high blood pressure, high cholesterol, diabetes, obesity, etc. So it's important to recognize these risk factors and treat them aggressively early on with a certain goal in mind so that it doesn't progress over to the more severe kind of heart diseases like heart attack and heart failure, like I was mentioning. So important to make sure that the blood pressure is controlled either with lifestyle or with medications. Cholesterol treatment, again, either with lifestyle, with your dietary habits and your metabolism, activated with the help of exercise or with medications. Diabetes, again, with the help of medications, and obesity with exercise and diet management. For obesity, if you're severely obese, then you can be referred over to weight management clinic that Baystate offers and have nutritional guidance as well with the help of dietitians. So those would be the risk factors that we manage pretty aggressively, or at least recommend the primary care physicians to aggressively monitor and manage. Like I was mentioning, for prostate cancer, they can have pre-existing cardiovascular problems already because of the metabolic abnormalities going on in their body from the prostate cancer. But at the same time, the medications that are offered, which is GnRH agonists or antagonists, they can specifically modulate the amount of hormones in your body, which causes a lot of imbalance and leads to all these other metabolic problems. Scenario 3 is a 60-year-old female that has a breast cancer. She is a breast cancer survivor, but it's been almost a decade that she's been in remission. We see a lot of these patients as well. And she received radiation treatment back then when she was going through fighting cancer. She has absolutely no symptoms. But one of the interesting parts about cancer treatment is that 10 years back, they may not have actually observed what your heart was doing and how it was doing while you were going through cancer treatment. So the oncologist decided to have like one-time surveillance, echocardiogram, ultrasound of your heart to check if everything is normal or not. Again, because these drugs, when they were being initially developed, the goal was to cure your cancer, but nobody looked at what their long-term effects would be on your heart. And some of these medications can have deleterious effects on your heart, even one decade down the line. Some of the drugs can have effects even up to 2 or 3 decades down the line. So this patient's echocardiogram is abnormal again. The heart muscles are weak, but she's got no symptoms, absolutely. So what we need to do is make sure that the heart weakness is not because of any other problems. Like I said, with age, you can have more problems. There could be fibrosis, there could be some infiltrative cardiomyopathies, there can be coronary artery disease affecting the muscles of your heart. So we made sure none of those were the reason why her heart muscles were weak. And we came to a conclusion that it was probably from the drugs and the radiation that she got to her heart while she was going through the breast cancer treatment. We started her on medications, which are expected to improve the heart functioning eventually. And then she follows up with us in our cardiology clinic once every few months. Again, radiation therapy is not something we spoke about all this while, but it can have fibrotic effects and it can kind of shrink the muscles of the heart. It can affect the valves in the heart, cause more calcium deposition and fibrosis in the muscles as well as the valves of the heart. It can impact the electrical system of your heart as well, and it can thicken and fibrose the external covering, the pericardium of your heart. So radiation therapy has a set of its own problems, but a lot of patients start having symptoms from radiation therapy impacting their heart health about 5 years or more after the radiation therapy is completed. So radiation therapy side effects on the heart are not immediate. It takes time for the heart muscles to modify a little bit, or the heart organs, heart structures really to modify a little bit and start presenting with certain symptoms. So in conclusion, I think we spoke a lot about how cancer and cardiac diseases have shared risk factors. If you're a smoker, quit smoking. If you do a lot of alcohol, cut down on alcohol intake. Make sure you have a healthy lifestyle, an active, healthy diet, active lifestyle with good exercising in order to curb, mitigate these risk factors early on and prevent development of heart issues down the line. Cancer therapy advancements have also resulted in a lot of cardiac side effects in short term as well as long term. So it's important to ask your oncologist about, are there any potential cardiac side effects with the medications being used? And that doesn't mean you don't opt for those treatment options. You opt for whatever gets you to remission of your cancer. And your cardiologist and cardio-oncologist will work with you and your oncologist in order to support your heart health for this whole while. Prevention is the key. Make sure you're preventing any major cardiac diseases development in future. Early diagnosis, if you've got symptoms, don't ignore them. Go talk to one of your physicians. It could be your primary care physician, your oncologist, or anybody that sees you. Make sure that you have a referral to a cardiologist if there is anything concerning about your heart, and make sure that you have a good lifestyle. That's the gist of my whole presentation. And I can take any questions if anyone has.
Thank you, Dr. Bhatt. I applaud your expertise and the work that you're doing with your patients. Well done. And
Thank you.
great presentation. We
Thank
do
you.
have some questions
Okay.
to start. And I just want to remind the audience to type your questions into the Q&A box, and we'll address as many as we have time for today. The first question: do all patients receive a cancer diagnosis automatically see a cardio-oncologist?
No, they don't. So the primary cardiac assessment is done by either your primary care physician or your oncologist. But if you tell them that you've had shortness of breath, you've had chest pain, and again, all the red flag signs we spoke about, dizziness, lightheadedness, feeling like your heart is beating faster than usual and you feel it. Those are the kind of symptoms which is going to trigger your oncologist to say, hey, let's work you up a little more. Also, a lot of the oncologists already have a certain protocol in place to check your heart while you're going through cancer treatment. So if anything comes abnormal in one of those tests, you'll be referred over to us.
Very good. Thank you. The next question: for somebody with cardiovascular disease and hasn't started treatment, which condition becomes the priority? Might CVD delay cancer treatment?
We try to work very closely with your oncologist. That at this point of time, because of the cancer treatment advancements, fortunately, there's a lot of medications in the market which can be used even when you have active cardiovascular diseases. But the more severe ones, like say you're having a heart attack or you're in florid heart failure, those are the kind of issues that needs to be tackled before you can go on cancer treatment. So if you're really sick with some of these heart issues, that might delay your cancer treatment, because your outcomes with cancer treatment, even the best cancer treatment at that point of time, if you have such severe heart disease, might actually be grim. So we might want to take care of your heart before your cancer in those situations. But in somebody who has other more minor or moderate problems, we usually co-manage with your oncologist and make sure that you're getting both the treatments accordingly.
Fantastic. It's such a team effort for the patients. It's
Correct.
terrific. The next question: what percentage of individuals diagnosed with cancer also have heart issues?
That's a great question. I would say that it's about 20 to 30%, but I'll have to look back into the literature. But the gist is that those who have been diagnosed with cancer for the most part are also older, who also tend to have a lot of cardiovascular diseases. They may not be really diagnosed with cardiovascular diseases until they have a diagnosis of cancer, because a lot of patients don't see their doctors as often. But again, when you get evaluated, it's important to just have like a, in general, evaluation of all kind of, issues in your health.
Excellent. Do HBP, and maybe you'll have to explain that abbreviation, meds
High blood pressure.
reduce, uh, uh, thank you, reduce cardiac vascular disease?
So a lot of high blood pressure medications have been shown to have beneficial effects in outcomes of cardiovascular diseases as well. But that really depends on the kind of cardiovascular disease you have. For example, if your heart muscles are weak and we try to put you on a medication called as metoprolol, or say lisinopril and losartan, those medications have actually been helpful in not just management of high blood pressure, but also reduce your cardiovascular disease related adverse events. But if you have a normal looking heart and you have high blood pressure, then I think management of high blood pressure is going to try to reduce any kind of bad outcomes in terms of your cardiac diseases in future.
Excellent. The next question: is the monitoring of heart issues done by an oncologist or cardiologist?
If you really have an active heart condition that you've been diagnosed with, like I was mentioning, coronary artery disease, or if you have heart failure, cardiomyopathy, electrical rhythm issues, etc., you should have a cardiologist. But say it's you predominantly have cancer and you're just being followed through by your oncologist, then they're going to be the ones managing it. If you have an active cardiac issue, you should have a cardiologist.
Very good. Is there one cancer treatment that's more strongly tied to causing subsequent heart issues?
Really depends on the cancer that you have. But for patients with breast cancer, I would say trastuzumab and the anthracycline medications have been associated with heart issues. But each one of your cancer has a specific kind of drug regimen that you're going to be offered. And it's important to talk to your oncologist about how this could affect your heart health in future.
The next question is a bit specific, so I don't know how you feel about answering it, but this person had breast cancer treatment, including radiation, and they're on anastrozole for 5 years. The oncologist is suggesting that I'll be on the medicine for 7 to 10 years. Can I request a heart workup at the 5 year point?
Yeah, absolutely. There's no downside. And in fact, if you're seeing a primary care physician, this should be like the general surveillance of how everything is going on in your body, including how your blood pressure is, how your cholesterol levels are, or diabetes level is, should be a part of your basic workup once every few years anyway. So you might already be getting this, but yes, you can specifically ask for it.
Terrific. And one more question. Does the breath hold method during radiation treatment really help protect the heart?
It does. It reduces the amount of exposure, amount of radiation that's getting exposed to your heart per se. So yeah, it's one of the recommended options to do when you're trying to protect your heart from radiation. It may not completely, reduce. It reduces the amount of radiation that your heart gets exposed to, but it may not completely curb it.
Can you explain that method for people that don't know
Yeah,
what
so
that is?
for the most part, the way radiation works is that there are two different, I would say, like an X-ray beam sort of set up, and the person that is getting a radiation would lay down on one of the beds, which exposes the particular side which is affected. Could be lung, could be breast, or anything. And the patients are asked to take a deep breath in. That's when the radiation is offered to the patient. so that the lungs come in the way of the heart. And there's not, the heart basically fades away as much as possible. And it's really the part of the lung or the breast exposed, which is going to get most of the radiation and not the heart.
Oh, very good. Fascinating. It looks like we're at the end of our questions. We'll just give it another pulse. Oh, and there's a thank you. And
Yes.
I think we all are very grateful for your time and expertise, Dr. Bhatt. Thank
No
you
problem.
so
I am
much
really
for
happy to be
this.
here. I'm glad that I was able to answer so many questions. This is, again, this is not a topic just for patients that have cancer. I feel like everybody should know more about this because cancer is so prevalent lately. So is cardiovascular diseases. You will have somebody or the other going through cancer and cardiovascular diseases in your family or your friend circle. So people should know, talk more about this particular subspecialty and get referred if you do have an indication.